Good morning, everyone. Thank you so much for the invitation to present our work this morning. So the title of our abstract the title of our abstract is as shown. Acute lymphoblastic leukemia has a higher incidence and a worse survival in United States Hispanic populations relative to non-Hispanic white populations. And this has been seen across time periods. So the figure on the left bottom shows across time. You could see the incidence among Hispanics, as denoted by the green triangles, has increased. And also across the age spectrum, with this disparity increasing in the young adult age group. Sorry, I don't know why my slides seem to be doing their own thing. According to the US SEER data, which is population-based data in the United States, approximately 42% of all newly diagnosed ALL among the AYA age range of 15 to 39 years are among patients of Hispanic ethnicity. And we know that likely there is a biological association, as Hispanic AYA ALL patients are more likely to have high-risk PH-like aberrations, including rearrangements in the CRLF2 gene that are associated with inferior survival. And so we think that partly explains why population data have shown worse survival in Hispanic ALL relative to non-Hispanic white. 10403 was a US multi-center phase 2 trial. The purpose of the trial was to evaluate the pediatric ALL regimen administered to young adults in adult cancer centers. Accrual on the trial occurred between 2007 and 2012. This was open in 31 states and 57 cancer centers across the United States. 295 patients were enrolled on this clinical trial, and the primary publication by Wendy Stock and colleagues was published in Blood 2 years ago. The figure below shows the breakdown by race and ethnicity. As you can see, although the figure looks a little odd, among the population on this clinical trial, 17% were identified as Hispanic. And the population for this sub-study included the patients who identified as Hispanic, non-Hispanic white, and non-Hispanic Black. And so, the questions for this particular sub-study was trying to understand why was the proportion of AYA Hispanic patients on the CALGB 10403 trial lower than population estimates, 17% relative to 42%. And then secondarily, how did the survival of AYAs treated on this trial compare to population estimates by race and ethnicity? And so for the first aim, we used a national database looking at statewide incidence of AYA ALL and then among Hispanic patients as well. And for the second, we used population survival data from the US SEER registry. These maps show our geographical incidence results for the distribution of AYA ALL across the country. So on the left is just all AYA ALL patients, and the little suns denote the hotspots of AYA ALL in the United States. On the right shows the proportion of Hispanic patients among each state, and as you can see, these maps look relatively similar, with hotspots being in the West and the South. Now here on the left, we show the map of the proportion of Hispanic patients with AYA ALL across the country versus the enrollment onto the CALGB 10403 trial. And you can see just visually the disparity in where patients came from across the country relative to where the Hispanic AYA ALL patients were. However, we dug a bit deeper and found that geographical sites were only part of the story, because we looked across states that did enroll Hispanic patients, including the top 6, as you can see here. And we found that relative to the population incidence of Hispanic AYA ALL in the state, these states each significantly under-enrolled Hispanic populations. And just as an example, California enrolled 34% Hispanic patients, but the proportion of Hispanic AYA ALL in California is 65%. So we know that geographical alignment may be low-hanging fruit, but improving enrollment of Hispanic and other ethnic and racially diverse groups is a complex issue that requires a multi-pronged approach. Okay, lastly, we looked at survival by race and ethnicity. And on the left, you can see population-based estimates of survival of AYA ALL. The red curve represents non-Hispanic white patients, the blue curve Black patients, and the green curve Hispanic patients. And you can see that both Hispanic and Black patients had substantially inferior survival relative to non-Hispanic white patients in population data. Now we look at the trial data on the right, and you can see in the red curve looks about the same, the non-Hispanic whites. However, the blue curve, the Black patients, continue to do poorly. The interesting curve is the green curve, which is the Hispanic patients, who did as well as the non-Hispanic whites on the clinical trial. We then looked at the differences among trial participants across race and ethnicity, and we found no difference in typical prognostic factors of age, sex, BMI, white blood cell count, or cytogenetics. However, we did find differences in three variables. One was yearly household income, so more poverty among Hispanic and Black patients. And then finally, we did find biologically inferior subtype of CRLF2 was increased among Hispanic patients, so you would think these patients would do worse. Again, my slides are a little off. I don't think it's shown on the slide, but the other key finding that we showed, or that we found, was that actually the one thing that could have at least possibly explained these findings of Hispanics doing as well on trial was that their protocol treatment adherence was quite good. So non-adherence among Hispanics was 24% versus non-Hispanic whites, which was 44%. And so in conclusion, the lower than expected accrual of Hispanic patients on CALGB 10403 can be at least partially explained by geographical distribution of study sites and enrollment patterns. And this begs the question of, can cancer epidemiology aid clinical trial selection to reduce racial and ethnic disparities? Analyses would have been even more impactful if evaluated on a regional level. And additional factors not explored in the studies contribute to under-enrollment of differing ethnic and racial groups. To close this gap, understanding and resolving additional reasons for subgroup under-enrollment must be a priority of clinical researchers. And despite the increased frequency of poverty and PH-like ALL among Hispanic patients enrolled on the CALGB 10403 trial, these patients were most adherent to study treatment, and outcomes approximated those of non-Hispanic whites and were superior to population estimates. However, Black patients continued to do poorly. I would be happy to take any questions. Thank you.